I'm a pastor, an artist, an author, a scholar, and a conversation. Welcome to Chatfest with Kenneth. Hello, and welcome to another episode of Chatfest with Kenneth. And for this episode, I am actually at the MGM, as you can see. Ta-da-da! So I'm just sitting down here, enjoying the ambience. It's a beautiful day out here, so I figure I might as well be in here to do this video recording. So this episode is about Toru-Angiama community. So the Toru-Angiama community, which is originally where I am from, it's in Patani local government in the Delta State region of Nigeria, and I had never been there before, even though that's where I'm originally from. Yeah, I was born in Macomb, Illinois, so I came to Nigeria and I never really went to where my father was originally from. So when I did my social heritage tour in August, I went there for the first time, reconnected with the heritage of my youth, and I got to meet a very important aspect of the community, which is the healthcare. So the community does have a health center, and the health center that they have is actually, before I go any further, I would watch this video of which is my cousin, and then I will go further to explain.
Hello everyone, my name is Benebi Benataria Broker. I'm from Toru-Angiama community, Delta State, Nigeria. I want to talk about the Toru-Angiama healthcare initiative started in May 2021. After my visit to my home village of Toru-Angiama, Patani local government, Delta State, I discovered that the local government had just completed the new building for the healthcare center, but it was not being used effectively. The center had only one nurse who could not be available 5 to 7 days a week. So I met with some of the young persons who were trained healthcare professionals and asked if they could volunteer at the center and make it a center of basic healthcare services for the Toru-Angiama community. Two young men, Ebenezer and Ibibalokeni, agreed. I sought the permission from the healthcare department of the local government area, and the local government authorities also agreed. The two young men and others started volunteering since May 2021, and initially I have appealed to the good people from Toru-Angiama to donate towards an allowance for the time out these volunteers did for the community. And part of the work, which included providing basic healthcare services, childbirth and immunization. The healthcare center is now the first point of call for healthcare and emergencies within the community. I am appealing to the good people and philanthropists of the world for donations to help scale up the healthcare provisions and services provided by the volunteers. I have been using various funds donated by close associates to pay for the volunteers a monthly stipend and motivate them and cover the basics such as food while they are at the center. It would be appreciated if more could be done with bigger donations that would go into upgrading facilities and provide stipend funding on an annual basis. For the coming year of 2021, we are looking to raise the sum of at least 1 million naira to cover the basic cost of funding volunteers and provide healthcare services to the Toru-Angiama community. As a start, I hope you listen to my call and donate graciously. Thank you for your time.
So as you can see from what my cousin Binaibi, hey, shout out, from what he explained, the concept of helping the healthcare practitioners in the community was inspired by him, and I just came in to support. And so when I visited in August, I I had a chance, I had the opportunity to interview them, to talk with them, and so just hear what they have to say, and I would come back. Free healthcare services that's being performed here, so I want to see what exactly is being done, and how we can bring more awareness to it, as well as um, philanthropy, and raise money for it. So, the two people who are, how many are you guys, first of all?
Two.
There's just two of you that are doing it. And this is, can you introduce
My
yourself?
name is Ebenezer. This is the Toru-Angiama. This is my community. I'm a volunteer working in Toru-Angiama Health Center. I did community health in College of Health by UISA. So what we normally do in the health center, we carry out malaria treatment, antenatal care, and we also carry out delivery. Any case that's above our level, then we refer to the hospital. That is normally what we do. Carry out COVID-19 vaccination, immunization.
Okay. Do you educate the people on how to, when COVID was happening, did you have any COVID incidences here?
No, but
Okay.
In the state level we have.
Okay, okay. And you are?
My name is Ayayi Ibidikemi
Okay.
from Toru-Angiama community, working in the Toru-Angiama PAC, volunteer, taking primary health care services to our people. What we are seeing now is COVID-19 card for prevention of COVID.
Okay.
And we are looking for the persons who have this card, so that in case they want to travel to other states or other country, they can be able to go freely.
Okay. So, what made you guys do this?
We do it because it's like form of appetite. Like our people need it,
Okay.
and many of medical doctors that are not here, so we are doing it so that they can have healthy environment, healthy body.
And it's our community, we belong to this community. So when primary health care, we don't have access to health, like a burden to us. So we went for the school, we came back for now, so we take it as a burden, and let us work as a team to help our community. So we
Okay.
can have
So what what assistance would you guys be needing to help you further and make your work easier, and to make your work to influence better? What help you guys need?
What we need is finance support,
Okay.
finance support. Also, if there is malaria drugs, because some of the parents, they don't have money to afford the drugs, so if there is malaria drugs, so we need it.
So malaria is the main thing.
Yes, it's a very pandemic.
It's a pandemic here.
It's
Okay. Okay. So you need financial support in terms of drugs. What about equipment?
equipment. Even the state government sent some of equipment to us.
So do you have a location?
Yes.
Okay.
work in the health center.
So there is a health center.
Yes.
And that's it. And the health center is like a
A building.
Buildings, like that is the
Yeah,
hospital
mini
we have in our
hospital.
community.
okay, so like the mini hospital in your community.
Yes.
And you guys are the practitioners there.
Yes.
Is so if I lived here and I fell sick and I came there, I will see one of you.
Yes.
Okay, are there any nurses or anything?
we have only one nurses and she's not based there, so
she comes
she
from.
come and go. So that
Okay.
we feed
The community-based workers working now, so I'm
Okay.
working to support her.
Okay. There's no doctor.
Yeah,
Okay, so you guys are the doctors.
Yeah, the community level.
The community level, yeah, the community level doctors. And then anything that is a little bit more complicated, then you refer to them, to the hospital. Okay, that's impressive.
Thank you, sir.
We'll take your information and we'll see what we can do.
Okay, thank you. Welcome.
Welcome.
Thank you. So as you can see from the interview, they do need support. They do need a lot of help. And the concept is to initiate a free healthcare for the community. So since we are literally going out of pocket to support them, we do need to raise funds annually to help. Doesn't have to be significant, but every little bit helps while we wait for the support of the government. And so here are some of the, this is a community center, pictures of the community center and what they do to support the community. And while we're at it, because initially the plan was to come in and raise awareness for the free healthcare initiative that we're trying to start in the community, and then the flood happened. And this flood is, I'm sure, if you're not aware, there is a dam in Cameroon, which is a neighboring country. And so every time there is an overflow and a release of water from the dam, it kind of causes a cascading effect of flooding. This year, unfortunately, it has affected over 30 states, and over 600 lives have been lost. Yes, it is cataclysmic in its effect. Livelihoods have been affected. In the riverine areas, their primary source of income or livelihood is farming. So most of the farms have been flooded, and so they definitely are waiting for support. Yes, the government is going to help, but we can't just sit there and wait for the government to help. So we definitely do need to raise awareness and to raise funds. So I'm going to show some effects right now of what has happened.
Oh yeah, come now. Oh yeah, now. Oh. Don't you? I'm not telling you. I'm not telling you. Abu, I know I will be crum kumu. And I remember building this water swim. Oh, Benbu Wakas, no, I'm gonna buy, I'm gonna area. Oh, Key currents.
Wait, give it to me, go on the line. Oh, Daniel. Daniel. Boy. I need to bring the boat. I don't know like me here.
We are good to go. We are good to go. Ah oui. How you be a guy? The guy man nigga side boy. Do? How far now? Huh? You don't enter, Abi? Don't they go, Abi? Then no.
Come around. That was way blue by man. Kalar man.
Tim
You mean the father? Kalar man.
I'm doing videoing stroke. Isn't I 1,000 like that, yeah? Why they come with my phone? Abo.
This is my parlor, as you can see. To tell you the devastating effect of the flood that have affected myself and my entire family. This is a disaster. Honestly, this is a disaster. This is my room. The area is flooded. As you can see the platform. This is the third time we are carrying out a platform. You can see this is my library, and it's a turn to something else which I cannot even explain. This is my room. This is my wardrobe. The thing is flood is a disaster. This is my corridor. This is my parlor, and That's my son going out. This is my parlor. There is sea light in the house. The water is getting the window level. This is my parlor. This is the first time I have seen my house being flooded to this level. This is my corridor. This is the outside. I'm just trying to organize platforms to prevent the properties from being destroyed. And that's my son going out. This is outside. As you can see, the area has turned to a natural pool that I cannot even explain. We need government attention for intervention. Honestly, this is beyond even the state government alone. It's a disaster. This is a disaster. This is a disaster. As you can see, the flood is a disaster. This is beyond human beings' imagination. It's a total disaster that's my son going in. The whole of the estate is being submerged by the flood. Honestly,
This is the current state of Toru-Angiama, Ward 7, Patani LGA.
So the peak of the flooding was in early to mid-October. So yeah, the waters are receding now. Unfortunately, with the recession of the water doesn't mean they are out of the woods. Recession of water is not immediate; it is gradual. So there is the aftermath of the flooding, which is sicknesses. Contaminated water leads to a dysentery, cholera, typhoid fever, stagnant. There are lots of stagnant water that is all over the place, leads to more malaria. So they're more susceptible to malaria. And then, of course, since they are farmers, most of their life crops have been affected. Their livelihood has been affected. Some people have had to leave where their home, their abode, and go find temporary shelter somewhere. Also, some places that are where their houses are flooded, they leave their homes to go find refuge somewhere, and then vandals go and vandalize their homes. So it's just it is a lot. There are lots of fundraising going on right now to help raise money and awareness for what is going on. I am the director of public relations with the Ijo Diaspora Council, so a GoFundMe page has been set up there. And while that is going on, my direct community that I am a part of, that I am from, we are also raising funds. So nothing is too little, especially because of the currency exchange of Nigerian Naira. So any little dollar that you can give, it does go a long way. And so this is a clarion call to viewers to support. Just because the flood recedes does not necessarily mean that they are out of the woods yet. There is still going to have to be long-term resuscitation for the people, getting rehabilitated. Schools have had to be shut down. Homes will have to be refurbished. Livelihoods supported. It is a lot. And unfortunately, $1 million was all the U.S. government gave. Don't know how that will be translated in being trickled down to the grassroots people, but this is a call for a cry out for support. Thank you very much for the little that you can do. It is appreciated, and As always, support, support, support. Thank you very much.